Hi, welcome to our telehealth video information series. I'm Garvin and this video is on Zyvox. So what is Zyvox used for? It's used for complicated skin and soft tissue infections and pneumonia. So how does Zyvox work? Zyvox tablets, oral solution and infusion all contain the active ingredient Linezolid. Linezolid belongs to a new class of antibiotics called the oxazolidinones. It is used to treat infections caused by bacteria. Linezolid works by interfering with the production of proteins that bacteria need to multiply and divide. This inhibits the ability of the bacteria to grow and replicate, and therefore stops the spread of bacterial infection. The remaining bacteria subsequently die or are killed by the immune system. Linezolid can only be used to treat infections with a specific subgroup of bacteria called gram-positive bacteria. Linezolid has a different mechanism of action to all the other classes of antibiotics. This means it can be used to treat gram-positive bacterial infections that are resistant to other antibiotics. An example of this is an infection with the superbug MRSA. Such bacterial infections have become more common, particularly in hospitals, due to increasing resistance of bacteria to antibiotic treatment. As Zyvox works in a different way to other antibiotics, it may provide doctors with a new line of attack for these types of infections. To make sure the bacteria causing an infection are susceptible to Zyvox, your doctor may take a tissue sample, for example a swab, from the skin or sputum. So Zyvox is to be used with caution in people with decreased kidney function, people having hemodialysis for kidney failure, and people with severely decreased liver function, uncontrolled high blood pressure, people with tumour of the adrenal gland and tumour in the intestine called a carcinoid tumour, and thyrotoxicosis, and also to be used with caution in people with bipolar affective disorder, people with mental disorder with symptoms of schizophrenia and mood disorder, acute states of confusion, anemia, and people with low numbers of white blood cells in their blood, and people with low numbers of cells called platelets in their blood. And Zyvox is not to be used in people who have taken a monoamine oxidase inhibitor medicine in the last 14 days, and also in breastfeeding. Zyvox oral solution contains aspartame, which is a source of phenylalanine and is not suitable for people with phenylketonuria. Zyvox oral solution also contains sucrose, and so is not suitable for people with rare hereditary problems of fructose intolerance, galactose or glucose-galactose malabsorption, or sucrose isomaltase insufficiency. This antibiotic is not recommended for children and adolescents under 18 years of age, as there is no information regarding the safety and efficacy in this age group. Also, Zyvox should not be used if you are allergic to one or any of its ingredients. So please tell your doctor or pharmacist if you have previously experienced such an allergy. If you feel you have experienced an allergic reaction, stop using the medicine and inform your doctor or pharmacist immediately. So for pregnancy and breastfeeding, the safety of this medicine for use during pregnancy has not been established. It is not recommended for use in pregnancy unless considered absolutely essential by a doctor. And this medicine may pass into breast milk. Mothers who need to take this medicine should not breastfeed their infants during treatment. So the side effects of Zyvox, common side effects, include headache, diarrhea, nausea, yeast infection of the moist areas of the body, especially the vagina and mouth. And uncommon side effects, decreased numbers of red blood cells, hemoglobin, white blood cells or platelets in the blood, inflammation of the vagina and difficulty in sleeping, pins and needles sensation or numbness, blurred vision, sensation of ringing or buzzing in the ears, which is tinnitus, and inflammation of the wall of the vein with a blood clot forming in the affected segment of vein, which is thrombophlebitis. and inflammation of the pancreas, and inflammation of the stomach. The side effects I've mentioned does not include all the side effects reported by the medicine's manufacturer. For more information on any of the possible risks and side effects associated with the medicine, you need to read the patient information leaflet provided with the medicine or speak to your doctor or pharmacist. So how can this medicine affect other medicines? This medicine must not be taken by people who are taking monoamine oxidase inhibitor medicines, which are used to treat depression or Parkinson's disease, or who have taken a monoamine oxidase inhibitor medicine in the previous 2 weeks. So examples of these medicines would be phenelazine and isoxocarboxide, also the maclobemide for depression, and selegiline or rasagiline for Parkinson's disease. So these medicines should be avoided. Zyvox should not be taken by people taking any of the following medicines unless the individual is under close medical observation and their blood pressure is monitored. The SSRI antidepressants such as Prozac, tricyclic antidepressants such as amitriptyline, and triptans for migraine such as sumatriptan, and rizatriptan decongestants, so pseudoephedrine, and phenylpropanylamine, which is ephedrine, and medicines that open the airways such as salbutamol or Ventolin, and adrenaline. So that brings this telehealth video to an end. If you have any questions, you can leave them in the comments below or contact me through our website, mytelehealth.info, or call into us at Lynch's Pharmacy, Douglas, Cork, or ring on 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.